Obviously, Fernande, we're still waiting for the decision, but given that the US, Canada and Israel are already using the jab for adolescents aged 12 and above, are we expecting the EMA to also say yes?
I think it's safe to say so, Annette. I mean, there's a little bit of a delay, but I think we can expect it to go that way. And that, of course, is a big step towards achieving herd immunity. Now, children and teenagers do not get very seriously ill from COVID-19, but they can help spread it. So approving this vaccine for use in teenagers is really a first step towards that herd immunity. Now, as you said, it is the only vaccine currently approved for over 16-year-olds. The other 3 vaccines approved by the European medicine agencies, AstraZeneca, Johnson & Johnson, and Moderna, they're only approved for over 18s. However, Moderna is catching up. 3 days ago, it announced that it too had run clinical trials and had reached an efficacy rate of 100% in adolescents, which is the same as Pfizer has reported from its clinical trials. And Pfizer actually is not just stopping with adolescents, it is already conducting trials on children as young as 6 months old. It expects to have in July results on 5 to 12-year-olds, and after this summer it expects to have by September results on children even younger than that.
Fernande, if indeed the EMA says yes, how quickly will that decision take effect?
So if the committee here approves it, it'll go back to European Commission in Brussels. They have to issue a final decree that's legally binding in all 27 member states. However, it is definitely expected because Germany has already told its adolescents that they can book in appointments as soon as the 7th of June. Now, health authorities in other countries will have to make that decision themselves. But of course, the big question for this rollout is, are there enough vaccines? Europe has been catching up of late. There's been 300 million doses distributed. About 46% of the European population, adult population, now has had its first shot, and they say they are still on track to reach that 70% goal by summer. But there have been supply issues. Johnson & Johnson has only been able to deliver 10% of the 55 million doses they were supposed to ship. And of course, the EU has taken AstraZeneca to court because of the lack of deliveries that they've been receiving from them. 50 million short in the first 3 months of the year. In the second quarter, we're expecting 180 million doses. Only 70 million of those are supposed to be delivered. But the good news here is that they have upped the ante with Pfizer. They've increased the deal. Another 50 million Pfizer vaccines expected to arrive this quarter, and a whopping 1.8 billion through 2023. So if those vaccines do arrive, it's expected that children will be able to get a jab before they return to school after the summer holidays.
Fernande van Tets reporting there from Amsterdam. Thank you.